Dear colleagues, the topic of my talk is measurement of shear stress on the surface of carotid plaques using high frame rate vector flow imaging. In this talk, I am going to present results of our study, where we attempted to use vector flow imaging to assess wall shear stress on the surface of carotid plaques. We think that some of the questions we ask in this study may have tremendous benefits to the area of modern vascular medicine, specifically detection of vulnerability of carotid plaques on the basis of difference in wall shear stress values. Let's begin. To use a reference from stories of King Arthur and Knights of Round Table, I came from a kingdom far, far away, if the word far is even applicable anymore in the current and unconnected world. I am based out of one of the largest medical research centers and hospital groups in Moscow, Russia, Federal State Clinical Research Center, FMBA of Russia. Disclosures. I have nothing to disclose. As a bit of background, just a few words about vector flow imaging. Vector flow imaging is a new imaging method which employs a very high frame rate, up to 600 per second, in order to visualize blood flow velocity at any given point and to compute true flow vectors and velocity magnitude at each location within the vessel. What's very unique and interesting about vector flow imaging is that quantitative evaluation of velocity vectors allows for more precise measurements of wall shear stress. Wall shear stress is the friction that happened between the blood flow and the vessel wall. Actually, it is a product of velocity gradient near the wall. Wall shear stress is the key factor for the quantitatively assessing pathological changes. The goal of this research is to assess the shear stress on the surface of carotid plaques. Methods. Study population included 28 patients, 20 males, 8 females, aged 33, 87 years old. Median age was 64, with or without presence of atherosclerotic plaques in carotid arteries. At all, 55 carotid arteries were analyzed, 36 of them twice, in order to evaluate test repeatability. We also measured pulse wave velocity in common carotid arteries. Plaque characteristics like echogenicity and degree of stenosis were also studied, and blood pressure and electrocardiogram were recorded. Exclusion criteria were atrial fibrillation, oncology, and severe renal disease. Arizona 7-system manufacturer Mindray China was used for vector flow imaging and wall shear stress measurements. Results. First, we needed to evaluate the test repeatability, or the comparison between two measurements of wall shear stress in the common carotid artery performed by the same trained sonographer on the same subjects at different time points. For this purpose, we used the Blend-Altman plot and average measure interclass correlation coefficient. As you may see, there is a good test repeatability. The average difference between measurements was just 0.1, or about 3%. We found direct correlation between wall shear stress and blood flow velocity. Increased stiffness of the artery wall negatively affects wall shear stress. There is a negative correlation between pulse wave velocity, that is a measure of stiffness, and wall shear stress. Significant heterogeneity in wall shear stress values was detected in carotid bifurcations. Part of the vascular wall close to turbulent opposite flow had much smaller wall shear stress values in comparison with areas that came into contact with laminar flow. You may see the examples of these findings here, and this is the difference. Atherosclerosis development and plaque buildup resulted in lower wall shear stress values, Patients with plaques and carotid arteries had smaller wall shear stress than those without plaques, and this is the difference. We observed significant negative correlation between wall shear stress and intima media thickness. These findings regarding atherosclerosis corresponded with existing data. Now, we will examine the complex relationship between wall shear stress and atherosclerotic lesions. Generally, wall shear stress on the surface of plaques depends on degree of stenosis and plaque geometry. High stenosis leads to higher velocity, which results in higher wall shear stress. Parts of plaque that contact with increased flow velocity have higher wall shear stress than those that located close to areas with turbulent flows. This difference depends on degree of stenosis. We found direct significant correlation between difference in wall shear stress values among parts of the plaque and degree of stenosis. Wall shear stress on the surface of carotid plaques had correlation with echogenicity. Hyperechoic plaques had significantly smaller average wall shear stress than hyperechoic ones with similar degree of stenosis. This is the difference. One possible explanation of this phenomena may be that hyperechoic plaques are more stiff, and we earlier demonstrated that stiffness negatively correlates with wall shear stress. However, the most striking and interesting result was that hyperechoic plaques have marked heterogeneity in wall shear stress values between different parts of the plaque. In comparison with hyperechoic ones, the degree of stenosis was the same, and this is the difference. Here you can see one good example of this. We can see that wall shear stress on the surface of hypoechoic plaque is higher in comparison with hyperechoic one, even if these plaques have similar degree of stenosis. This is hypoechoic plaque with significant stenosis, close to 70%, according to consensus classification. The peak systolic velocity is 233 cm per second. We may see a big difference in wall shear stress values between various parts of the plaque. Maximum stenosis corresponds with the highest wall shear stress, whereas the distal part of the plaque that had contacts with turbulent poststenotic flow has a much lower wall shear stress. One other important point is that vector flow imaging is a novel technique that allows us to see the small ulceration on the plaque surface. This presents a huge advantage over traditional techniques. B-mode ultrasound and conventional color flow Doppler does not permit you to observe this ulceration. Naturally, the lowest wall shear stress can be found in this place. So, we may ask, could the difference in wall shear stress between parts of plaque lead to plaque rupture? And could this difference potentially be linked with plaque vulnerability? And can the measurements of wall shear stress guide us in the quest for the detection of vulnerable plaques? To reference the King Arthur and Knights of Round Table analogy one more time, in that story one of the characters, Sir Galahad, is searching for the Holy Grail. While Sir Galahad is on his quest, angels appear, guiding him. And like these angels, which guide Sir Galahad in the quest for the Holy Grail, we are looking for a means to guide us to what one may consider to be the Holy Grail of modern vascular medicine. Undoubtedly, the method of detection of vulnerable plaques is the Holy Grail of modern vascular medicine. And perhaps our guides can be the measurements of wall shear stress on the surface of carotid plaques. Perhaps, but first we must deal with limitation. With regard to the limitation of the study, first, the study size is limited. Second, the difficulties in measurement of wall shear stress on the surface of plaques that require good quality images with clear boundaries that are difficult to obtain in many cases. Repeatability and reproducibility of Wilshire stress measurements need to be assessed and evaluated further, especially intra- and interoperator reproducibility for the Wilshire stress on the surface of carotid plaques. The result of the study requires confirmation in additional studies, possible with MRI. These are very difficult times, and as vascular physicians and sonographers, we are doing what we can. It feels like a lifetime ago, but this is me on these photographs taken in our hospital in Moscow only weeks ago. Needless to say, for the moment, we could not continue this research due to our emergency attention to COVID-19. I will say, however, that as we are working, we are also thinking about how any of our research can be applied to the fight against COVID-19, given that this disease has a significant vascular component. We do think that there are some relevances and have some ideas about it. In summary, our findings offer early indication that Wilshire stress values on the surface of carotid plaques can lead to early detection of carotid plaque vulnerabilities. We think this is very promising, and we do have plans to continue the study in the future. Thank you very much for your attention. If you have any questions and would like to learn more, you can always contact me via email. This is my email. Our door is always open. Our coffee is always warm, and we appreciate any feedback, input, and ideas for collaboration. Thank you again.